Hi everyone, I'm Dr. Divya Joshi. I'm the infectious disease specialist at Bangalore Fortis hospitals. I'm going to talk to you regarding monsoon and its perils. Don't worry, it's going to be an infectious disease talk itself. I'm going to highlight about the infectious perils of monsoons. Broadly speaking, we've all seen an increase in the respiratory flu cases in the coming few weeks. So today I'm going to highlight a few signs and symptoms and alarming signs that you need to understand regarding these infections. The respiratory infections include influenza, which can be the H1N1 influenza, it can be the H3N2 influenza, it can be influenza B, it can be metapneumoviruses, it can be respiratory syncytial viruses. Also, it can be COVID. We have a huge array of these viruses lurking around and it gets intensified during the monsoon. So, we end up getting fever, and it can be high-grade fever. The fevers can go up to 103, 104 degree Fahrenheit. And we have respiratory signs. You might have running nose, you might have severe headache, you might have severe body ache, severe body pain, and you might develop cough. All of these are signs and symptoms of respiratory viral infections. When you get a respiratory virus infection, make sure you wear a mask to protect your family. If you are developing signs and symptoms pertaining to respiratory distress, or if you're feeling breathless, please visit the hospital for immediate care. How can we combat these respiratory infections? We do have vaccines for influenza, which protects against influenza A, 2 strains, and influenza B. So it's extremely important to vaccinate yourself and your family. It is approved for all adults as well as in situations where your immunity is low. So please gear up, vaccinate yourself and prevent the infections. The next most common infection that we all see is the dengue infection, which rises during the monsoon. As we all know, it is spread by the dengue virus, which is acquired through a mosquito bite. What happens during dengue? So when you get a dengue infection, your body feels feverish. Mind you, it is a virus infection. So again, the temperatures can go very, very high. And you might develop some skin rashes. You might develop body ache. You might develop body pain. And with these signs and symptoms, you might see some changes in your CBC also. You might develop decrease in the platelet counts. You might see some WBC drop in your CBC levels. Also, you might have some features of nausea or vomiting or abdominal pain. So when you develop these signs and symptoms, get yourself tested. But how do you prevent against these infections? How do you prevent against a dengue infection? For that case, wear full protected sleeve cover yourself and make sure the mosquito doesn't bite you. When you go out, apply Odomos and make sure that there is no stagnant water around you. So always prevention is better than cure. And in these situations, always try to prevent by doing these preventive measures. Thank you.